The incidence of new postoperative atrial fibrillation after cardiac surgery is 20 to 40% and is associated with increased risk of death, stroke, need for anticoagulation, and readmission. This study evaluated the use of a wearable device for continuous cardiac rhythm monitoring after cardiac surgery. The primary endpoint was assessed within 30 days following discharge from hospital, and this analysis was performed in 318 patients who underwent either coronary artery bypass grafting, valve surgeries, or combination procedures involving both, across 10 medical centers in Canada. Patients randomized to the device group wore patch-based cardiac monitors for up to 30 days to check for atrial fibrillation. Each patch provided continuous cardiac rhythm monitoring for 7 to 14 days. Patients in the control group received usual care, which did not involve routine cardiac rhythm monitoring within the first 30 days after hospital discharge. Postoperative atrial fibrillation occurred in 8.2% of patients who underwent coronary artery bypass grafting, 13.5% of those who had valve surgeries, and 21.1% of those who had combination surgeries. The majority of atrial fibrillation episodes occurred during the first 2 weeks following discharge, with considerably fewer events occurring during weeks 3 and 4. Among patients who underwent valve surgery, the use of a wearable, patch-based cardiac rhythm monitoring device was associated with a twofold increase in the rate of postoperative atrial fibrillation detection within the first 30 days after discharge. Rates of anticoagulation prescription did not differ between the intervention and the control groups. The devices were well tolerated overall, but premature device discontinuation occurred in 1/3 of patients in the intervention arm, mainly citing reasons such as personal preference and skin irritation. Wearable, patch-based devices for rhythm detection appeared to be an effective tool for monitoring the cardiac health of patients during a critical postoperative period.